Cardiac Rehabilitation Explained by Dr. Warwick Bishop and Dr. Alistair Begg, with Penelope Edman. Forward by Dr. Emily Granger. Narrated by Richard Wray. Forward by Dr. Emily Granger. The concept of holding somebody's heart in your hands has enthralled many surgeons and physicians for decades, if not centuries. Restoring blood flow and creating new pathways for blood to travel are amazing medical advances and often profoundly life-altering for patients. These advanced techniques of revascularization and treatment, however, are merely the first step in a patient's journey back to health and a desirable quality of life. Without a pathway to recover, heal and rebuild, the benefits of surgery and stenting are harder to achieve, difficult to realize, and maybe even beyond reach. Cardiac Rehabilitation Explained is a guide for those patients who entrust us with their lives and, of course, their hearts. When my patients nervously sign the form to consent for major surgery, they want to not only know that the plumbing will be good, but also that there is a path back to life, exercise, work, and their families. Cardiac Rehabilitation Explained is there for these patients. Many questions are asked prior to the operation, but even more come afterwards, as the nerves settle and the light switches on at the end of the recovery tunnel. This book is an excellent reference point for cardiac patients, answering all those questions that are remembered in the middle of the night whilst machines go bleep and blood pressure cuffs inflate. Most of my patients remark, "But doctor, I was perfectly healthy a week ago, and now I have to have my chest cut open for 3 bypass grafts." More than 500,000 Australians have ischemic heart disease, but the diagnosis is still surprising for some. For these patients, the focus is very much on the up-and-coming surgery or stenting procedure. Their life is placed on hold to enable them to get through a life-saving operation. After the initial thrill of "I have survived," there is a letdown when they suddenly realise the effort then required to heal and recover. Almost 50% do not return to their normal work capacity after a heart attack, and nearly 25% do not return to work at all. Cardiac rehabilitation looks to support patients back to a healthy lifestyle and the work capacity they desire. Even in the complex area of cardiac transplantation, cardiac rehabilitation is recognised as critical to patient outcome and quality of life. As the wounds gradually heal, patients realise they have swapped a Morris Minor for a Ferrari. Spurred on by the excitement of a new heart and high dose of corticosteroids, the post-operative cardiac transplant patient will benefit from this book too. For it not only is about educating the patient on the new medications and a healthy lifestyle, but also the graduated return to exercise, physical activity, and mental preparation for the challenges ahead. This book takes us on a journey and utilises a wide spectrum of interviews with patients, medical professionals, and specialists in rehabilitation sciences. The language is engaging and easy to read, and information is well referenced. One of my patients once remarked how he read the same newspaper for the first 3 days after surgery, and each time it was like reading it anew. But as he recovered, his voracious appetite for reading left no book unturned. Combined with the discovery of a fitness tracker, he hasn't looked back unless it is to take a selfie with the other mammals, middle-aged men in Lycra, on their Saturday morning bike ride. Now I have the perfect book for him. Emily Granger, MBBS Honours, FRACS, Cardiothoracic and Heart and Lung Transplant Surgeon, St Vincent's Hospital, Sydney, New South Wales. Lecturer, Clinical Medical School at St Vincent's Hospital, the University of Notre Dame. Member, Royal Australasian College of Surgeons. Dr. Emily Granger has performed more than 3,000 general cardiothoracic operations and more than 300 heart and lung transplants. Emily completed her medical degree at the University of Queensland and her surgical fellowship with the Royal Australian College of Surgeons, RACS, in 2006. She is involved with the New South Wales Organ Tissue Donation Service and Deceased Donor Organ Procurement, and in 2014 was involved in the world's first successful donation after circulatory death heart transplant.
Sample complete. Ready to continue?